Nurses. Hey, Monday motivation. Remar nurse. Oh, I gotta start in the Remar nurse way. You know, when Remar nurses do testimonials now, they start with songs. So I gotta go, a way maker, miracle worker, promise keeper, light in the darkness. My God, that is who you are. That is my testimony for today. I have seen miracles. And if this is your first time here, you know what? This is Monday motivation. Let's talk NCLEX. This is where your life changes this week. I am saying that to you. Stay here during this episode, and your life will be different when we are over. And I'm just challenging you to do that. If this is your first time, also, not only is this Monday motivation, but you happen to be with the number one NCLEX instructor on the planet. My name is Regina MSN, and I love helping nursing students pass their NCLEX exam. You can consider me a mentor if you don't have one. The way that I communicate, the way that I share my products, share my knowledge is right here, remarnurse.com. It is the home of every amazing nurse who has ever endeavored to honestly pass their NCLEX, but not be overwhelmed during the process. If you are in love with nursing, if you're passionate about, your future as a nurse, but you also want to study in a right way that makes sense and is effective to you, as well as keeping God first, because you know that he is where everything comes from, then remarnurse.com is your family. And today, like I said, today is a day of miracles. And I'm just going to tell you guys a short story of one of our Remar nurses. But before I do this, the Monday motivation is what has driven you to come here. Like every week, we endeavor to give you motivation that will carry you. And that's the difference between Remar Review and other companies. Like, we want to be in your face. I want to be in your face. I want you to know me. I want you to hear my voice. I want you to understand that you are not alone. So your Monday motivation for this week, I love this topic. I was working on it yesterday. The topic for this week is what hurts more than change. And you're probably thinking, oh my goodness. What hurts more than change? And I want to answer that question. So you just think about it right now in your own minds, what you think it could be, but I'm going to answer it for you. So it's not a mystery, but I got to introduce you to our newest nurse. Yeah, Nurse Tope, but say it. Timatope. Yes. So anyways, listen, this nurse, if you're not a part of our Remar Nurse Facebook group, shame on you, because great things happen in that group. But we got this testimonial from our Remar nurse, and literally it is exactly the reason why I get up in the mornings, period. So if you don't know her, this testimonial is amazing, because you look at this nurse right here. She's representing Nigeria. So we got an international nurse. English is not her first language. And some of you guys know the struggle of when you're in nursing school and you got to take that information you learned in school. And like she said, she had to take it and translate it into her mother language just so she could understand it. This is an example of perseverance here for everybody. I don't care. And I'm telling you this is not a story. And this is what she said. This is not a story of somebody that's failed multiple times. This is not a story of somebody who couldn't get over, the devastation of testing and failing. Like, this is a miracle story, because Nurse Tope, she didn't even have this in order to be able to test. Does everybody know what that is? Does everybody watching, do you understand what this symbol means? You understand what this symbol means? Shout out to all my international nurses, Uganda, Philippines, Puerto Rico, where else? Nigeria, Haiti, all the places that I love, Abu Dhabi, whatever, Mars, Canada, everywhere you are watching this, this international nurse did not have her green light to be able to even schedule a test date. This represents the green light from the program ATI, right? So some nursing schools use a program called ATI in order to be able to determine if their students should even attempt to take the NCLEX. Like, this is the program that they use. So Nurse Topi, when she got into nursing school, she listened to something that an advisor told her. And you got to be very careful who you listen to and whose words you take in, because this advisor told her that ATI is going to prepare you for NCLEX, right? So somebody spoke a prophecy over her and said that it will be ATI that will prepare you for NCLEX. So she went forward with that information, even though that's not what God had planned for her. So you guys have to be very careful that you are not taking information just from any old body, but that you consult with the Lord first. So before I get on that hobby horse, she could not get the green light from ATI. She was unable to meet the scores of the ATI. And she was just off by a little bit. She was just off by a little bit. But you know what? That roadblock had her whole life on pause. She could not move forward. She didn't graduate from nursing school. She didn't, listen. She not only did the ATI program once, right? Because, that program was what her school told her she had to do. But she did the program. She said she had the coaching. The coaches told her to do thousands of questions, right? And it was such a struggle because she said that she wouldn't even get the feedback from the coaches whether the questions were right or wrong. She was just told to do these questions, right? So she did the units and she did the program, couldn't get past the green light. You know what their advice was for her? Buy it again, right? Buy the program again. So she spent about $1,000 on this ATI program, on these ATI coaches. And nobody, and I love what she says in here. She said, nobody was talking to me. Nobody from ATI was talking to me. She said her niece turned her on to REMAR review. She had never heard of REMAR review before. The niece said, this is what you need to help you pass. And so, and this is a story that may be similar to some of you guys. When she first encountered REMAR, one of the things that she first noticed about this company, what's different about this company? One of the things she first noticed about this company was that we are a faith-based company. Yeah, that's right. That's right. We do it differently than anybody else. We are a faith-based company. So Mark had prayed and she was like, wow. She said, this was her words, I didn't think Americans prayed, right? Let alone nursing education, but like Americans, nursing education. Yes. Americans, we pray. That's how we get down at REMAR review. So Mark prayed, she connected with the company, but she still had this thing in her mind that ATI was going to prepare her for NCLEX. Didn't happen that way. You guys know it didn't happen that way. So it was a challenge for her because she was essentially walking in faith. She began to study with REMAR review. She got the DVD package. She said she was doing these Monday motivations, didn't miss a Monday motivation, but yet she never had her green light. She didn't have an NCLEX test date. There was no possible way she was going to ever take NCLEX without ATI giving her the green light, because that's what her school was committed to. She was walking in faith, preparing for NCLEX. Okay. She said she couldn't connect with ATI. It was a struggle for her. And one day while she was watching REMAR review, watching myself, I told her about a free event that we did. It's a little thing you guys might remember called REMAR Nurse University, right? REMAR Nurse University. And we went to different cities. Well, she lived about 4 hours away from the Chicago location. But she heard that I was coming to the city. She said she didn't hesitate. She got a train ticket and signed up for the Chicago chapter of Remar Nurse University, right? No excuses. She had to be there. Listen, she came to Remar Nurse University, got the $25 book, got the everything, had the package, met me. This is her and I talking at the event, you guys. Don't sleep on this testimonial. This is a miracle testimonial. This is her telling me her story that she cannot get that ATI green light. She cannot test. And I told her, I signed her quick facts. I told her, may your nursing journey be over in this way, right? I told her there was only one thing she had to do. She had to go back to her school. She had to go back to her school. She didn't want to do it at the time, but she said after she left Remar Nurse University, she felt so comfortable. She felt so empowered. She went back to her nursing school. Like me and her, we hashed it out. We talked about it. We took the photos. She went back to her nursing school. And you know what? She went back to her nursing school. And when she went back to her nursing school, she told them what she had done, right? She told them she did the self-study package. She did the 6-week program. She did the Remar Nurse University. She did everything, the Monday motivations. And she was shocked because her advisor, somebody that she was really close to, had never heard a Remar review before. So she got to introduce Remar and the way we do things to her school, right? Because at the school, her school was using ATI, right? And so her advisor said, well, you did all these things. You went to this conference. Let me think about it. Let me think about what we're going to do with you, because I told her to go back to her school. So she was going back to her school to tell her school she was done with ATI. She was never going back there again. She had invested over $1,000, couldn't get this green light. She was done with ATI. So she was expecting them to say, well, then your nursing career is done because our school uses ATI. And if you can't get this green light, you can't test. You can't be a nurse. So she said at that point, she was saying, I don't want ATI. I want nursing. Just let me prove myself. Let me prove myself based off of what I did with Remar. This is serious. This is walking in faith. This is a testimonial. There was no sight of an NCLEX date for her. So fast forward, her school, this is the miracle. Her school gets back to her and they say to her, you have not passed with ATI. You have not gotten that green light. But because you invested in yourself with this Remar, because you have taken the responsibility of doing it for yourself, we are going to allow you to sit for your NCLEX exam. She said they gave her the paperwork. They handed over the paperwork to her and said, send it off yourself. You have this privilege. Look, these things do not happen. This is a miracle. Okay, this is God performing a miracle. She was at the sea and he parted it so that she could walk through straight way. I am so excited that these type of things are happening in our Remar nurse family. And I can't even express the emotion that she probably felt when she was allowed to usurp what man had put in place for a divine appointment. Y'all don't see that. There are barriers that man put in front of you, but God has the power to clear all of those things out of your way so that you can test. And if you stand on what you believe, there's nothing too hard for your God, right? There is nothing too hard for your God. So she was able to get a test date out of nowhere. She was able to go around the rules of the institution in order to sit for her exam. Miracle testimony. Somebody needs to hear that. Somebody needs to hear that, because not only did she get a test date without getting that ATI green light. But you know what it is. She said she began to pray. She began to pray. She began to pray. She began to pray. She prayed pharmacology out of her exam. Okay, she was on a roll. Once she got that test date, she said, I'm going to start asking for the things that I want. I don't want pharmacology in my exam, right? She said the pharmacology she got in her exam, she knew it. Otherwise, it was not on her exam. She prayed her way through those SATA questions. She went in there expecting all 205 questions, because that's how we get down around here. We don't go in there looking for the minimum. We go in there looking for the maximum. And I'm just telling you guys, she took the test. She did not get the maximum. She said she got about maybe about 100 questions. Her computer screen shut off. She left out of there with the victory. So this is our newest testimonial from our Remar nurse. Hey. Representing Nigeria, second language. Share goals. Listen, share goals today, 1,000, period. Based off this miracle. Somebody needs to hear this testimonial. Somebody you know need to hear this. Share this video. Oh my goodness. So good, you guys. I cannot even, I'm just spending so much time on it because you guys do not realize how effective your struggles can be to motivate somebody else. And it's really not about, and I'm gonna stay on, this ain't even the Monday motivation, but I'm gonna stay on this because when you guys understand that your purpose is not about you, finding your purpose in life is not about just you. It's about you helping somebody else to get where they need to be. Once you understand that, you will be successful in everything that you do because it's not about you. You are in the habit of giving out of your own self without any expectation. So I got to just tell you guys this, your testimonials, you are a living testimonial. You need to pass NCLEX and then tell that story. Yes, this is Nurse Tope. Yes. This is what I'm talking about. Pass NCLEX, tell your story. All right. It's the most powerful thing that you have. It is your own testimony. So yes. All right. So I also want to say, you know, these kind of stories are what really motivate us. What really motivate us here at Remar Review. And I told you, stick around because this is a life-changing episode right here, right? So you guys that are passing here at Remar Review, we are giving away a cruise for two. Don't forget, we will be announcing our winner in just a few short weeks now. Just a few short weeks right now. So we're giving away a cruise for two. Hey, not only you, but somebody that you love. We will be sending you guys on an all expenses paid cruise. We're going to fly you down there. We're also going to give you $500 to spend. This, I don't know if anybody else is doing these types of things. We just want to show you that we love you. Our family, Mark and I, we took a cruise last week. I was finally on vacation with him. I did 0 emails. I did 0 work, and it felt so good. Oh, so good. And that's probably why I'm super pumped to be back because I really did miss you guys. But we were on this fantastic cruise, and I just want to say I am super happy to be giving away a cruise for you guys because it was the best kind of vacation. We didn't have to worry about anything. So I loved it. I loved the experience of the cruise. Our kids had a good time. We had a great relaxing time. We got to visit the Bahamas, Turks and Caicos. It was just nice. So I'm going to be super happy for the winner who wins. So you pass NCLEX, you send in the video testimonial, and then you are picked to be the winner of a cruise for two. So I'm really happy about that. Another thing that we have going on, if you guys are studying with Remar, we have another free event coming. It's kind of what we did last month where we did the Winning Wednesdays. We're keeping that going. We got so much positive feedback about Winning Wednesdays that we are keeping it going. So we will be studying from the DVD workbook. So if you have this program, if you've committed to the 6-week challenge, oh, you're going to be so happy because I'm going to be going over this book with you, making sure that you understand the best points, right? So I'm not going to be able to cover the whole book, of course, because I want you to have the package, buy the package, but I will be going over some highlighted points here. So Winning Wednesday will be August the 7th. That's next week, right? August the 7th and August the 14th. I don't know why I said that like I'm surprised, is coming up, and it's going to be happening in the Remar Nurse Facebook study group. So you guys need to get into that group if you are not there. This, one of the things about our NCLEX study group is that we want to make sure that you're not just in there just lurking around, right? We want you to be active. We want you to feel like you're part of a community. So I will be going live from in that group. It's where we're going to come together and we're going to be studying this book right here, okay? The student DVD workbook. And I think it's just going to be a great time. Winning Wednesday starts next week at 9 a.m. Eastern Standard Time, right? Promptly at 9. And it's going to last about an hour, maybe a little bit over an hour. So be there or be square. If you still need to purchase your DVD self-study program, guess what? You can do it. You can do it. And I'm going to give you a code for it. Use the code REMAR, R-E-M-A-R. You're going to get 5% off of that self-study program. And it comes with my 4 books, personally written by me, personally recommended for those taking the NCLEX exam. And I don't care what your school used to prepare you. I don't care what other people are telling you you need to use. This is the program that is changing lives. This is the program that is getting people their license in their hands so that they can begin to work. So that's all I recommend for you guys, okay? So again, Winning Wednesdays, it's a free event. All you got to do is be part of the Facebook group, all right? This is the community where we give back. We love you guys so much. It is time for your Monday motivation. It is time for your Monday motivation. Take 2 deep breaths to receive your behavior modification for this week, okay? And it's just thoughts that I want you to think about. So for this week, what really resonated with me was this. There was a survey, and there was a survey of why people are terrified of change, because most of us know that in order to get results, we have to change something that we are doing. And so one of the top reasons why people are terrified of change is because you have to get rid of your comfort zone. You have to get rid of your comfort zone. And for myself, and I'm speaking on your behalf too, that comfort zone is killing us. Literally, it is strangling us. It is paralyzing us. Where we are comfortable and where we have settled in to not studying, not making NCLEX a priority, is causing us to put everything else on pause. Like our life that we're supposed to be living, the freedom, the working where we love, and having the letters, having those credentials behind our name is not happening because we've settled into a comfort zone where it's cool. It is what it is. I'm not studying today. I am studying today. I'm watching TV. I'm Netflixing. I'm chilling. Doing everything that I am not supposed to be doing. But the things that I am supposed to be doing, I don't have the energy for. I don't have the desire for. I'm sleeping. I'm napping. I am just not making this life a priority. Like there's a grind. I try to narrow it down to a 6-week challenge, but you guys are making it a 6-month challenge. You guys are making it a 6-year challenge because you're not committed to the process. When you think about it, you're settling. The comfort zone is a place of settlement. And everything that settles ends up where? At the bottom, right? When you think about things that are in liquid or things that are in something and it settles, where does it settle to? It settles to the bottom. So we got to get out of the comfort zone so that we can get up to the top where we're supposed to be. You're the head and not the tail. All right. So I like this quote by Thomas Edison. He says, "We shall have no better conditions in the future if we are satisfied with all those which we have at present." Isn't that good? Like, things are not going to get better in the future if we're happy with how the present is. What are we striving for? If you're comfortable working at a job that's not nursing, if you're happy working there, what is going to motivate you to press on to get into that nursing job? I mean, can you imagine? Oh, I could take this there, but I'm not going to take it there. Can you imagine if Thomas Edison was just satisfied? Can you just imagine if he was just satisfied by letters and having horses deliver letters across the country? No, you don't pick up the telephone. Can you imagine how game-changing that was, right? In your own life. Are you just satisfied right now driving the car you're driving, working the hours, the double time? I know some of you guys are working 2 jobs. Some of you guys are working 2 jobs right now. And if you got your nursing license, you would be able to work 1 job 3 days a week, 12-hour shifts, and get paid for the 40 anyways. That's what we're trying to be on for this year, right? So if you're satisfied with everything in the present, then you're not going to want to progress to something better in the future. So I never want you guys to settle. Never want you guys to settle. So that was one of the things why people don't change, because they love their comfort zone. I need you guys to hate the comfort zone this week. Hate it. All right. Another reason is, and I think this is an interesting one, avoiding the possibility of failure. Avoiding the possibility of failure. And failure is such a scary thing. It is a scary thing because it doesn't feel good. Who wants to be put in a position where you cannot succeed? Well, that's the difference. Like, it's so easy for people who are not doing anything to sit back and criticize those who are actually trying, right? And, there's a lot of people that are spectators when it comes to sports, but to be down on that field is a different feeling. I need you guys to be ready to be on the field, to be ready to play. It's okay. It's okay if you fail, but what's not okay is if you never try. That's not okay. So here's the thing. If you never try, then you never have to worry about failing. And this is the idea. It's just better to live in a dream world. It's just better to dream about it. It's better to daydream and imagine how good it will be instead of actually going out to try it. But if you daydream, if you're going to daydream, you're going to understand that that is going to cause you to waste a lot of time. It is going to cause you to waste so much time. Take Mark and I, for example. Mark and I, when I met Mark, I'm going to fast forward. When Mark and I decided that we were going to get married, guess how long it took us to get married? Can you guess how long it took Mark and I to get married? When we have all these big exams, not big exams, but big event. Yeah. So Mark proposed to me in August. We got married in January. So August, September, October, November, December, January. We waited 5 months and we got married. And that was a long time for us. I don't even know why we waited that long because now it just doesn't make sense. Instead of you just dreaming about, how good it's going to be, how great it can be, just do it. Just do it. Once you make a decision, commit to it and keep going, because all of that time daydreaming and planning, that's just time wasted. Nobody is promised tomorrow. You have to be able to take action, walk in it, and go. So I'm trying to encourage you guys to do that today. Just go. Mark, we're not going to wait that long again to get married again. All right? No. So the third reason why people hate change, why people are terrified of change, is because they don't want to lose control. Oh, that is such a big one. Feeling like you're in control of that little bitty comfort zone is so, is so reassuring. But it's a sense of false comfort, because actually you're not in control at all. Actually, you're not in control. When you don't have that nursing license and you're just working, this is what I find. I find that when you have a craft and a skill, when you have some education and talent, you, in terms of the workforce, you become the one with the power. You become very valuable to your employer. When you guys get that nursing license, you will be able to literally write your own check. You'll be able to write your own ticket. You will be able to work where you want to work, when you want to work, for however long you want to work. We are in a very interesting time in nursing, particularly for me in nursing education, because it's called like the perfect storm, because we don't have enough nurse educators, but at the same time, we don't have enough working nurses. And wow, there are so many people that want to get into nursing, there's not enough educators to educate them. And while there's so many people that need nurses in their hospitals, there's not enough nurses to work all the shifts and to care for the patients, and we're irreplaceable. So all of this for a nurse means that you have an enormous amount of control of where you work, how you work, and how much you get paid. And you also have an enormous potential to grow, because there are a ton of nurses that are leaving, they're retiring from our profession. We need new nurses. We need you guys to come in and take leadership position. In nursing, it's not like in law or like in other industries, executives and marketing, where you have to, work your way 20 years to get to the top. No, when you get in nursing, you get a few years under your belt, you're at the top. All right. You are like a unicorn because you have what is desired, right? So feeling like you have to give up control for just a little bit is worth it, is an investment into a future that is unknown, okay? But very positive. So I know you guys are listening to me. You have to let me tell you what to do. You have to give up control. I'm telling you, let me show you how to get your license. Let me tell you what to study. Give up that control. Give up them little coins, that small amount of money. Invest it, because it will be worth it, all right? It will be worth it. We're talking about why people are terrified of change. And let me bring it on a personal level. Like my mom, if you guys know my mom, she does not like to fly. She does not, or she didn't used to. She does not like to fly, right? She does not like airplanes. It's not her thing. Some of you guys are probably like that too. You definitely don't like to fly. That's it. All right. Well, God put me and my mom together, and it's very interesting because with my job, I do a ton of flying. Of course, I do a lot of traveling with what I do. And I take my mom with me everywhere I go. Like she does not, that's how much I love this woman, right? She goes with me everywhere and she watches my kids. She's just my mommy. So she had to give up control and begin to fly. Like literally every week, there are times when I'm flying and she's flying too. And some of you guys are like that. Like you don't want to give up control of this small thing, but literally when you give up control, you're able to see so much more. You're able to learn so much more. You're able to be more effective in other areas of your life. So now when my mom gets on the plane, she's like sleeping before the plane takes off, because she's so comfortable now. So I'm encouraging you guys to give up the control for a short time so that in the end, you will be comfortable. You will be more comfortable. Your family will be more comfortable, right? You'll be able to provide for others. In my wildest dreams, I never thought that I would be able to do what I'm doing, but it took some sacrifice for me to get there. And I'm trying to be here so that you guys can see what you can also be. If you can't see it, you can't be it. But if you can see it, then you will believe it. You will walk in it. All right. So this is the quote. Some of us think holding on makes us strong, but sometimes it's letting go. It's letting go that makes you stronger. It's being prepared for the change. And I know change hurts. Change hurts so badly because we have to sacrifice and we have to remove and we have to cut off layers. But you know what? What hurts more than change? And this is for somebody out here. This question is for somebody out here. What hurts more than change? Regret. Regret hurts way more than change, not getting to where you know you should be, not living up to your potential, even when it comes to failure, right? If you fail the exam and you don't give yourself an opportunity to test again, to try to get that license, you will live with the regret of not giving yourself the opportunity. You are worth it. Do not live with regret. Yes, it hurts. It hurts to change, but the pain of change is temporary. The pain of regret is permanent. Permanent. It is permanent, guys. Okay? All right? So, with that being said, your Monday motivation has been served. This week, we are looking forward to the change that is going to happen in our lives. And we're okay. We're okay if we have to sacrifice our comfort zone. We're okay if we have to give up control. We are okay. We are okay if we have to let some things go that you recognize are interfering with your goals of passing NCLEX. This is the week to do it. This is the week to do it. Okay? So with that being said, it's time for some NCLEX questions. It's time to get NCLEXing, and we're going to be going over pharmacology. You're going to love these questions. I'm looking for you to only miss one. Can you only miss one of these questions, right? That is the challenge for you all, and I think you can do it, but I'm going to test you. I'm going to test what you've been studying. Remar nurses, are you prepared? Okay, so I have like 4 questions for you, but you guys know how we do this. Our share goal today is 1,000. Our share goal today is 1,000. Is that possible? Is that possible, Mark? That was the number he gave me. I'm challenging you guys. Let's push it. Here we go. Question number 1. Question number 1. Mr. John White, a newly admitted client, has a seizure disorder, which is being treated with medication. Which of the following drugs would the nurse question if ordered for him? Okay. Number 1 is phenytoin, 100 milligrams twice daily. 2, amitriptyline, 20 milligrams 3 times a day. 3, valproic acid, 200 milligrams BID. And the last one is phenytoin, 200 milligrams 3 times a day. Which one would the nurse question? This is your pharmacology question. Here we go. Here we go. I am looking for the correct answer here. I'm looking for the correct answer here. You guys know what is happening. We have a patient. They have problems with seizures. Based on the medications listed, which medication would be inappropriate? I'm not going to delay this. I'm not going to belabor this. We are moving on. The correct answer right here, the correct answer, here we go, is number 2. Amitriptyline is an antidepressant, so we would not expect that. Yep, did you get that one? All right, here we go. I am moving on to question number 2. Question number 2 says, oh, this is a good one. A nurse is preparing to administer a morning dose of intermediate insulin. The vial has been sitting overnight. The nurse sees a solid precipitate inside the insulin vial. The nurse should, number 1, throw the vial away and draw from a new vial. 2, check the expiration date. And if still appropriate, gently roll the vial to disperse the particle. 3, shake the vial to disperse the clump. Or 4, roll the vial under warm water to dissolve the particle. So here we go. A nurse is preparing to administer a morning dose of intermediate insulin. The vial has been sitting overnight. The nurse sees a solid precipitate inside the insulin vial, right? The nurse should, number 1 says, throw the vial away and draw from a new vial. 2, check that expiration date. Okay. And if still appropriate, if it's still good, gently roll the vial to disperse the particle. 3, shake the vial to disperse the clump. Or 4, roll it under warm water. Roll it under warm water to dissolve the particle. I see a lot of 2s. I see a lot of 1s here. What is the correct answer? What is the correct answer here? Let me tell you what the correct answer is. Thank you guys for participating. I think you guys will be shocked based off of what I see here on Facebook and YouTube. The correct answer is actually throw the vial away and draw from a new vial. Yes, Leo, you got that one right. This is not going to be something that you're going to expect. Yes, intermediate insulin is cloudy, but this insulin is not just cloudy. What does it have in it, right? So it has some precipitate, some clumps in it. And when that happens, it can indicate that your insulin has been contaminated or that the potency is no longer going to be effective. This type of insulin should be discarded. You should not be injecting your patient with insulin that looks like any of these. So I hope this is helpful to you guys who didn't get it right now. Okay. But it's okay. All right. This is why you're here. If you didn't get this right, you are here to learn. Thank goodness you came today. Thank goodness you came today, right? Because we are supposed to learn. And if this is your first time seeing something like this, or if you're asking questions about insulin right now, if you're asking me or if you're asking yourself questions about insulin right now, what do I want you to do, Remar nurses? Do I want you to post a question and wait for me to answer it? No. I want you to look it up. So somebody asked, what is the insulin supposed to be cloudy? Is insulin supposed to be refrigerated? What am I supposed to do with insulin? Those are all things that you need to make sure that you know before you take your exam. Because if I tell you, chances are you're going to forget. But if you look it up yourself, is insulin supposed to be refrigerated? Guess what? You'll remember it longer. I guarantee it. I'm moving on to question number 3. Woo, we've already been studying for almost an hour together. Hey, it's about learning. It's about being better. Question number 3 says, a nurse is providing instructions to a client regarding quinapril hydrochloride. The nurse tells the client, number 1, to take the medication with food only. 2, to rise slowly from a lying to a sitting position. 3, to discontinue the medication if nausea occurs. Or 4, do not mix the medication with citrus fruits. Let's go, Remar nurses. A nurse is providing instructions to a client regarding quinapril hydrochloride. The nurse tells the client, number 1, to take the medication with food only. 2, to rise slowly from a lying to sitting position. 3, to discontinue the medication if nausea occurs. Or 4, do not mix the medication with citrus fruit. Hey, I think you guys got it. I'm loving what I'm seeing. Guys. I'm loving it. Let me tell you the right answer. You got it. To rise slowly from a lying to a sitting position, because look at the ending on this medication. What kind of medication is this? Everybody say it together. It is a ACE inhibitor. It is a blood pressure medication. So therefore, we know that it can lower the patient's blood pressure, whereas they can experience some orthostatic hypotension, right? If they get up too quickly and your blood pressure is low, more than likely you're going to get dizzy, you're going to fall out. So you should adjust your positions slowly. You guys got it. Yes, this is the content that you need for your exam. You gotta know about these principles. It's not about a strategy here. I mean, I don't know how I could use a decision tree if I don't even know what the medication is. What is the decision tree going to help me do? I don't know. What is the strategy? I'm going to be trying to think, okay, where do I even begin? Where do I even begin? You guys, you have to know this content. I cannot stress it enough. You have to know this content. All right, let's go. Next question. Ibuprofen is prescribed for a client with rheumatoid arthritis, and the nurse monitors the client for signs of an adverse effect related to the medication. Which of the following indicates an adverse effect? Number 1, nausea. 2, diarrhea. 3, anorexia. Or 4, dark stool. Give it to me. Put it in the comments. We're talking about ibuprofen, and we're talking about signs of an adverse effect related to this medication. I'm looking. What do you guys say? What do you guys say about this? What do you know about this medication? Oh, This is one of the basics. This is one of the basics. All right. All right. What do we know? I'm looking for the answers. They're coming in. I see it. You guys got it. All right. Yes. Some people don't have it. You got it. You might have it. I'm going to put the answer up. You might have it, but other people may not have it. That's okay. This is pharmacology. This is basic pharm. So the correct answer, guys, is number 4, the dark stool. The dark stool, and this is a fundamental teaching here. Okay, when you have an NSAID such as ibuprofen, they may cause ulcers. They may cause GI ulcers, gastric ulcers, gastrointestinal ulcers, bleeding, or holes in the stomach or intestine. Vomit that is bloody or looks like coffee ground, blood in the stool, or black and tarry stools should be reported to the healthcare provider immediately. And this is a basic safety point for your medication with pharmacology. Pharmacology doesn't have to be, yes, Yolanda, pharmacology does not have to be hard for you guys. Seriously, when it comes to NCLEX exam, it does not have to be tough. And you want to know how I can say that so confidently? Right here. This is a little book called Quick Facts for NCLEX. And when you look under NSAIDs, I highlight the major points of the medications back here. So I went to the book and I was like, okay, let me write a question from the book. Bam, just like that. And this is what you guys, this is what people that write NCLEX questions, they're nurses just like me. And what they do is they go to content, they go to books, and they pick out points and they write questions. All right. That's how the exam works. That's the big secret. That's the big secret of NCLEX, guys. It's content based. Question number 5. Here we go. A client is prescribed atenolol. The nurse should be most concerned about which of the following? Woo! This is a tough one. Here we go. Number 1, the client smokes 2 packs a day. 2, the client has a blood pressure of 145/85. 3, the client has a history of tachycardia for 4 months. Or 5, the client was treated for bronchospasms 2 weeks ago. What sayeth you guys? Don't be shy. Send in the answers. We're talking about atenolol. All right. Talking about atenolol. Take it all in. And you know what? One of the things that you guys have to do is you guys have to stop and pause. All right. Make sure that you understand what you're being asked. All right. Because some of these questions are very easy to you guys and you know the answer. But what happens is you're like, oh my goodness, I'm taking NCLEX and this is my big moment. And then you read the question wrong. All right. So some people that fail NCLEX is not because you didn't know the answer. It's just because you were anxious or you forgot to read the question all the way through. Okay. So the correct answer here, and I see you guys putting it up. I see you guys putting it up. Yes, yes. And I see, thank you for the rationales. Some people say, I'm picking number 3. Okay. Picking number 3, 2, 1. Some people that are picking the correct answer are also including the rationales. What a way to power study. What a way to power study. So number 1, the client smokes 2 packs a day. 2, the client has a blood pressure of 145/85. 3, history of tachycardia for 4 months. Or 5, the client was treated for bronchospasms 2 weeks ago. The correct answer, number 4. Yeah, number 4. This client was treated for bronchospasms 2 weeks ago. And you guys know that with beta blockers, who are they contraindicated for? Who are they contraindicated for? People with what? People with asthma, right? Because some beta blockers, they're non-selective. They're beta 1 and they're beta 2, right? So you have to be mindful. Somebody that had bronchospasm 2 weeks ago, well, you give them a beta blocker, they're going to be at risk for having more bronchospasms, right? They're going to be at risk for having more bronchospasms. So this is an issue. This is This is a pharmacology issue that you need to be aware of, because beta blockers are quite common. They're quite commonly seen in medicine and nursing school. Also, we know with beta blockers, this is a side point, but we don't want to give them to people with diabetes mellitus. Because does anybody want to know why? Does anybody know why? Most people are like, yeah, we want to know why. Does anybody know why? It is because with diabetes mellitus, when the blood sugar goes down, a normal response of the heart is to increase the rate. Right? Blood sugar's low, heart rate can go up. But if your patient's on a beta blocker, will their heart rate go up? No. It won't. So we have to be mindful of giving beta blockers to those with diabetes mellitus. Okay. All right. Just for your studying purposes, these are lists of beta blockers, and of course, you can try to memorize every beta blocker ever, or you can just look at that ending, that OL, or OLOL is very, very indicative of a beta blocker, okay? And for beta blockers, the common side effects of this medication, these medications will cause that bronchospasm. It's going to cause bradycardia. It can also cause some heart muscle dysfunction, right? Heart blocks is a blocker, so it can cause first-degree heart block. Of course, the blood pressure will go low. It will also alter electrolytes. It will also cause some disturbances. If you are taking them for a while and you don't take them, right, your body gets used to medications in general. So you have to be very careful. All right, so contraindications as well are listed here. And again, this is just me giving you some notes on beta blockers. The main points that you guys should be familiar with, though, is what they're going to do to the body, what are expected side effects, what are not expected side effects, and then who you can or cannot give beta blockers to. Share this video. This stuff right here is the good stuff that helps you to pass your exam. It helps you to pass your exam. All right. Now, I do want to continue. I'm not sure if we have our share goals. Mark, I need everybody right now, share this video, because I would really like to review Remar Nurse University, right? I just have a few questions from Remar Nurse University that I think will be good reminders if you have not tested and if you're studying to test. All right, please. Everybody, I actually have 500 people, about 500 people on Facebook. I actually have about 500 people on Facebook. So that is insane that and YouTube, let me see. That's insane that on a random Monday, you guys know it's time to study. Almost 300 people on YouTube here. So, woo, biggest study group right now, anywhere, period, right, in nursing education. So thank you, guys. Guinness World Book of Records should be here. All right, everybody, smash that share button. If you're on Facebook, smash that like button on the video so we can keep it rolling. We can keep it rolling. And here, all right, we need, what do we need? We want, okay. All right, so period. All right, so Mark said half. There's 90 shares right now. We need to get 250 shares. That's it. That's it. There's 500 people. We just need half of the people to hit the share button. We need you right now to hit that share button. And we're going to go over questions on Remar Nurse University. I'm looking at them right now. So if you missed Remar Nurse University, this will be kind of cool for you, because one of the things that I talked about was I talked about so much. I talked about EKG. Nurse Topi, she said that her very first question was an EKG question that we went over during Remar Nurse University. So that was pretty cool. It was something that if you have the DVD package, you probably already know it is probably there as well. So do we have it? YouTube, Facebook? I'm on my phone. Like, I'm trying to look and see, did we make our share goal? If not, we can do it next week, maybe. If not, we'll come back next week. What do you say, Mark Callion? Oh, yeah. Don't forget, while we give you the opportunity to share this video, Winning Wednesdays will be starting on Wednesday. Next week, we will be going over the student workbook. So just come. If you have your student workbook, you will be able to take notes directly from that student workbook. I'm really not going to deviate from this book much. I may throw in some additional study points and or questions, but if you have this book, we will be going right from this book for next Wednesday. I'm super excited. I'll actually be working on our class this week. All right, so I don't think we made our share goals. We just need another 60. If not, we gotta go. So I just need somebody to encourage 60 more people. I think YouTube hasn't. I think YouTube did what they were supposed to do. YouTube. Yep. So if I cut it off on Facebook and then go to YouTube, they'll be upset. All right. Okay. All right. Come on, guys. We just need just a few more. Say share, and we will keep going. Perfect. So if you have all the materials, all right. Yes. I have all the materials. That is cool. Thank you so much. Hi, Regina. Your visit to Atlanta really helped me to pass my NCLEX in June. Thank you so much. Thank you. I need your video testimonial. Somebody asked, what time is Winning Wednesday? Winning Wednesday start at 9 a.m. Eastern Standard Time. So early in the morning on Wednesdays, we will be studying. Aloha from Hawaii. Yes. I'm trying to get to Hawaii. I'm really trying to get there. Okay. So I'm at work, but I'm watching from Minnesota. Yes. Thank you for hanging out with us here. Thank you so much. Winning Wednesdays, it will be in the group. And remember, for Winning Wednesdays, if you don't make it live at 9 a.m., I leave it up. I usually leave it up all day, or I'll leave it up actually to the next week. So you'll be able to catch it there. Okay. So I don't think we made our share goals today. We just need how many? 20 more? Just 20 more? Okay. 20 more. I'm trying to stall. Somebody said, just do it on YouTube. Just do it on YouTube. That wouldn't be right. Joanna says now she's sharing twice. Now, come on. Well, I haven't put out my, I have not put out my travel schedule for my public reviews. I'm getting what the quickest way to get me there really is have your school bring me. All right. Some of you guys are in nursing school. Your school needs a live review. Have them to bring me, because that's what I'm doing right now. Like, schools are just bringing me in. I'm doing it for their students. Some schools don't know about Remar at all, and it's literally the students telling the nursing directors about us, and the nursing directors are like, "Oh, I didn't know that was available. I didn't know that I could have somebody come in." So do your class a favor, do yourself a favor, tell them about Remar. They can contact us, and then I will be able to come to your school. My reviews My reviews are 2 days, all right? So I come in for 2 days, and I also leave every student with the DVD self-study program. So it is a super cool, super awesome opportunity. All right, we are ready to go. Mark says we have the green light. We got Mark's green light to keep going. Let's go. The nurse is caring for 2 clients on a busy medical unit. The nurse will distribute equal amounts of resource to each client in an act of 1, justice, 2, non-maleficence, 3, fidelity, or 4, veracity. This is a Remar Nurse University topic. Also very important if you are studying and about to take NCLEX, you gotta know those legal issues in nursing. What do you say? What do you guys say? Is it number 1, justice, 2, non-malfeasance, 3, fidelity, 4, veracity? Oh my goodness. Oh, I'm so glad I'm doing this. Here we go. Here we go. Remar nurses, the correct answer. Some of you got it. It is justice. Yes, justice is the act that you make sure that if you got 2 patients, they get the same resources, they get the same amount of time, they get the same education. This is what we do. All right. Question number 7. Another topic is informed consent is a method that promotes 1, autonomy, 2, non-malfeasance, 3, beneficence, 4, justice. What do you guys say? What do you guys say here? Oh, yes. It is. It is. I like it. When we talk about informed consent, everybody knows what that is. But what is the purpose of informed consent? Oh, YouTube must have been on Remar Nurse University because they got it. Everybody, there's no fooling them. There is no fooling them. Number one is the correct answer. Autonomy. Autonomy. Here we go, guys. Here we go. All right. You guys are on a roll today. Here we go. Question number 8. A diabetic client delivers a 9-pound infant. Which nursing intervention is most important when the neonate becomes jittery and lethargic? Which one is most important? Number 1, administer regular insulin. 2, administer oxygen. 3, wrap the infant in a warm blanket. 4, feed the infant 10% glucose water. Got a 9-pound infant just delivered. Which nursing intervention is most important when that neonate becomes jittery and lethargic? Here we go right here. This is a great NCLEX question. This is a great NCLEX question right here because you have to really understand a lot of content here. And this is what I love about content is that it will carry you from diabetic mothers to infants to pharmacology right here. This is how content helps you to pass your exam, right? So the correct answer here, if you know about the diabetic mother, you know that she can deliver a larger than normal baby, and you know what kind of problems that baby's gonna have, right? That babies are gonna have problems with keeping their blood sugar up. So you need to feed that infant 10% glucose water, all right? Babies born to diabetic mothers have issues with hypoglycemia. So we would not give insulin. Oxygen here looks good. A lot of people picked oxygen, but it is not the priority here. You got to know your pathophysiology on this one. All right, Remar nurses, here we go. Question number 9 coming up. You guys unlocked some bonus questions. You unlocked bonus questions with those shares. I appreciate it. Last bonus question here. A client scheduled to have surgery is refusing the Foley catheter to be placed. The client states this is not a part of the surgery. The nurse should. Number 1, explain to the client that this was mentioned in the consent form that was signed. 2, explain to the client that this is a part of the procedure. 3, respect the client's wishes and document, or 4, notify the healthcare provider. What is the correct answer? Oh, now this is a tough one. This is going to be the divider. This is going to be the divider here. And I see a lot of 4s. I see a lot of 2s. I see 1, 3. Let me see on YouTube. I see a lot of 3s. I see a lot of 4s, 2s, 4s. Yeah, 2s. The correct answer is going to be the best thing for you to do for NCLEX right there. Number 3, respect that client's wishes and document it, okay? Because this client is scheduled to have surgery, refusing a Foley catheter, the client tells you this is not a part of the surgery. And that's true. Some of the time when we have surgery, why do we put in catheters? We put in for convenience. We put it in because, after the surgery, the client, it's better for them not to be ambulating, right? During pregnancy, when you're in delivery, sometimes the nurses will put in a Foley catheter for convenience. So you don't have to get up and go to the bathroom, all these things. But if a client tells you they're refusing it, they're saying this is not a part of the surgery, as the nurse for NCLEX, you better respect that client's wishes. Don't try to call the doctor, have the doctor come in and talk to the patient. No, you have to respect it. Don't try to explain to the client that this is part of the procedure. They said it's not a part of the procedure. The best thing for you to do is respect the client's wishes. Don't try to explain to them that it was mentioned in the consent form. That's not your position, right? That's the doctor's position. The best thing for you to do is respect that client's wishes and document it, right? So of course, in real life, some things might be different. You're more than likely the nurse will number 2, but number 3 is what's best for your NCLEX exam. Hey, you guys, you studied with me for over an hour. I just want to say that I truly thank you so much. But today's program was actually not about me. It was about the miracle testimony of Nurse Tope. They got the green light without ATI, got the green light through the power of God, through REMAR review, through working and persevering, and she made it happen for herself. So this week, I want you to make it happen. Make it happen. Do what you need to do so that you can progress. Congratulations again to all the REMAR nurses passing. Hey, you know what? I got a quick surprise for you guys. Guess what? You guys called for prayer. There are people that are testing this week. Nurse Tope said one of the things that motivated her to continue to study with REMAR is when Elder Mark Callion got up and prayed for the nurses, for them testing, for them not to have anxiety, for them not to settle, for them not to be afraid, for them to have the faith and the courage of David, right? So I'm going to ask Elder Mark Callion to come up and pray for you all this week, that you would be able to go forth in your journey. So can we have the elder come up? This is the REMAR nurse chaplain as well, here at REMAR Review. So we're going to have him to pray. Here we go.
Awesome. Thank you, Regina.
Hi, Mark. Thank you for joining us.
Congratulations once again, REMAR nurse Timmy Tope, for passing NCLEX and sharing your testimonial.
Thank you.
And we're so glad that you were able to connect with us, not only at the educational level, but also at the spiritual level as well, because Regina says, we are a faith-based company, and that's simply because we are the owners, and it's just a part of who we are. So we just want to share the best that we have with all of you all. So that makes so that Regina's giving you the best NCLEX information. We're giving you the best in terms of what helps us to grow, and that's spiritual development as well. Just a really quick word: when God called Israel, He called them not because they were a great nation, but because they were small. So right now, I'm talking to all of the small individuals out there, if you will, the ones that are struggling, that feel like you can't be successful, or you have anxiety, and this thing it feels like the situation is bigger than you. But I have to tell you that you serve a big God. And so what God did, He says, I'm going to take you guys because you're small, because you're weak, because you need help. I'm going to be that provider for you, and I'm going to lead you. And once you're successful, everybody's going to know that there is a God in Israel. Right?
Yes.
And so I'm going to do this for you. But I want you to do 2 things. Number one, 3 things. What I want you to do first is, number 1, believe that it can happen. Believe that you can be successful, even though you might feel small. And this is a big journey. This is a big step, a big accomplishment. You have to believe that it's possible and it can be done. Number two, I'm going to give you the promised land, but you have to be prepared to fight. Right. So I want you to suit up. I want you to put your war face on, if you will, and you're going to take these steps and move forward. And as you move forward, you're going to claim the land, but you have to walk in faith. You have to move forward. You have to be prepared for that battle. And number three, once it's all said and done, once the land is yours, once you're in the promised land, once you have that milk and honey, once you get that nursing paycheck, whatever that might be for you, once your family is stabilized, once your housing situation is good, once your bills are paid, what I want you to do when you're in that land is I want you to remember how you got here. Remember where you came from and how you got here. When you're on the job and the situation doesn't seem right, I want you to remember how you got to the job in the first place, how you got into nursing school, how you passed the test. I want you to remember, and so that it's not about you, it's all about God and what his provision is, so that when others see that you've been blessed, they will be able to reflect and say, okay, there is a God. I know this person is only here because of God, and they will be able to tap in as well. So just like we want you to share and join the Remar Nurse family, God wants you to share his word and join the kingdom as well. So with that, we're going to pray for everybody out there that feels that this situation is bigger than you, or you have felt intimidated. We're not doing that. We're facing the giants and we're taking it on in the name of Jesus. All right. So let us pray together. All right, fam, let's go. Father in heaven, we thank you once again for the miracles that you have shown through the Remar nurses, Lord. We celebrate Timothy on this day, but Lord, with so many testimonials that have come up even during this broadcast. Nurses are passing, Lord, and we want to say thank you for all of the success that you have brought. Lord, thank you for giving us a platform where we're able to lift you up and to recognize that you are our provider, where our health and our strength and our knowledge and all of that is good and perfect, Lord. We celebrate and say that it comes from you. So, Lord, ask that you would be with the nurses that are testing. Ask that you would be with the nurses that are preparing to test. And even those, Lord, who don't even have a test date in sight, that you would get them through the process, and that they would be prepared for the battle, and that they would be able to look back at the end of the day and say, if it had not been for the Lord who was on my side, where would I be? And let that be their testimony forevermore. In Jesus' name we pray. Amen.
Amen. All right, you guys, thank you so much for a wonderful Monday motivation / Let's Talk NCLEX. Let's do it again next Monday. Go in blessings. We love you so much here at Remar Review. We really do. We love to hear from you as well. So if you have any questions or comments, or you need to know like what's the best thing for me, please email us, support@remarreview.com. Don't forget, guys, Winning Wednesday next week, August 7th and August 14th, right here in the Remar Nurse Facebook study group. And we love to say this: it is what we believe for you guys. It is what we hope for you guys. And it is simply that together we can, we will, and we must pass NCLEX. Thank you, guys. To God be the glory. Have a wonderful week. We will see you next Monday.